Now, we are going to talk about the extremely exciting principle of regeneration. This is the very underlying science of healing, ladies and gentlemen, explained in science. So every second, it's pretty incredible to think of the numbers. You're producing hundreds of millions of cells every second and replacing or recycling cells that are no longer productive. You have a process going on in your body called apoptosis, where cells know when it's time for them to be done. They know when they're no longer effective for your health. They program their own death. They fragment off into things called apoptotic bodies, which are like little cells. They make sure their contents don't spill out and poison you. And then these little phagocytic cells run around your blood vessels. They sweep up these apoptotic bodies, and then they take them back, and they break them down, and then they're recycled back into the cell production process. It's an absolutely beautiful process in the body, and it gets down to the very design of how our body was designed to work. Hundreds of millions of cells a second. One thing I want to touch on real quick, and this is in your workbook. The science of how is what you're learning about right now. These millions of cells being regenerated, the principle of regeneration itself, you're learning about the science of how your body is designed to work. This is what your body is supposed to be doing. What we need to be very aware of is there's a difference in the science of now, in your life right now. Because you guys, your bodies may not be operating on this principle right now, not at full capacity. And you need to realize when you hear something about how the body was designed to work, you need to ask a question. And that's the science of now. Is my body able to do this now with how I treat it? With what I feed my body, with how I move my body, with what I expose my body to in its environment, with how I think every day. Is my body able to produce these hundreds of millions of cells that it needs to? I can tell you one thing that's going to get in its way right away. You want to know what it is? Most of Americans are on it. Drugs. Drugs. One of the number one things that gets in the way in the body's normal cellular regeneration process. One of the main culprits, statins. Does anyone here realize that cholesterol is not dangerous? Is that still a belief in this country? I mean, really? Do you guys realize that there are hundreds of articles written about statin drugs and cholesterol? There's been huge studies done, population studies all over the world that prove average populations of people who have higher cholesterol levels have less heart disease. We are a country obsessed with lowering our cholesterol. What's our number one killer? Heart disease? Are you kidding me? And you're not seeing this? You can't just trust people anymore. You must seek out information. Cholesterol is one of the number one most important key elements in creating a cell. One of the most important things in healing is that you can create cells at a rapid rate. What do you think happens when you get in the way of cholesterol production? You are going to get in the way of how cells are created in your body. Foundational health, foundational physiology. I was fortunate enough to be at a conference, and I heard Dr. John Gray speak. He's a PhD, he's a researcher. He wrote Men Are From Mars, Women Are From Venus. In this presentation, he talked about how he sat next to the creator of Lipitor and how this old man turned to him, and they were just talking about it because John Gray is openly, he's done the research and the evaluation of the research, and he openly says high cholesterol is absolutely no risk factor for heart disease, which is exactly what the data says, just so you know. And he asked this man, what was the purpose of creating this statin drug? And he said, I never intended it to be taken by people. It was for babies who came out of the womb with cholesterol levels in the 3,000s, and they had to get it down so they could live, or their blood was too thick. Chew on that one for a little. So, how fast are your cells being replaced? What does this mean to your body systems? Let's look at the lining of your digestive tract. This is the fastest turnover. Your mouth, esophagus, stomach, colon. The lining of your digestive tract is being replaced and regenerated roughly every 4 to 6 days. This is where I get the doubters who say, hey, I've had an ulcer. My stomach hasn't been turning over. I've had an ulcer for years. Healthy cell, enter into bad environment. What happens? Bad cell. They can be turning over, and if you're still treating your body the same way, ulcer still exists. It's that simple. Vital organs like your liver and your kidneys are replaced every 6 weeks. Very interesting thing in the clinic where we saw people who were working on lifestyle change and who were on high blood pressure medication. It was almost like their step down went on a 6-week cycle because your blood pressure is regulated by your kidneys. And it was so interesting to watch how their blood pressure would normalize as they were coming off of drugs. It was almost always, as we watched their numbers, every 6 weeks, as those new cells came into an environment where there was no beta blocker. It was so interesting to see how that body returned to health. The largest organ of your body is your skin, not it's out, is replaced every 4 weeks. Every 4 weeks, every layer of your skin is new. Question about scars, age spots, those types of things. Trauma is one thing. Trauma, you can completely disrupt the normal process of turnover in an area. I've got a scar that I've had since I was 13 from pitchfork because I grew up on a farm. The scar's staying around. It's minimized a lot, so the regeneration process has taken it down an awful lot, but it's still there due to the trauma. But age spots can go away. Skin can clear up. You can look way younger if you really want to. Everyone's like, how do I do that? How do I do that? Well, just keep going. The skeletal system is 98% new every 10 to 12 months. Your skeletal system seems like a very permanent thing, right? It's actually tissue, and it is regenerated. Now, everyone, if you were to go online and you were to Google any of these statistics, you would see 1 million scientists saying, this is bogus, I've never seen where that's been, I've never seen it actually happening in research, we never saw it. This guy, Paul, comes up and it talks about Oak Ridge and this study done in '54 or something like this. Let me explain to you the science of this because you will be questioned on this statistic, because I was. Dr. Paul Ebersol was a pioneer in the biologic and medical application of radioactive materials. So he used frequency and energy to read the activity of the body. Because as he would put radioactive isotopes and introduce those into cells, he could watch how long the cell would exist because the frequency of the isotope was present. As soon as the cell turned over, isotope gone, you could see that the cell had turned over. So he was the first director of the Atomic Energy Commission's Division of Isotope Development in Oak Ridge, Tennessee, which used to be an extremely prominent research facility back in the 50s. No one really knows this. Now, every year, the Society of Nuclear Medicine gives an Ebersold Award to the most prominent physicians in the world, and has since 1973. Dr. Ebersold witnessed research where he was watching cell turnover like this in the body. He wasn't a joke, and anyone in nuclear medicine or who works in isotopes would be able to tell you that he was actually an amazing visionary in being able to understand the cellular activity in the body, okay? So that is scientifically valid. So due to this process of healing, this regeneration that happens in your body, all you need to do is change the environment and the resources that your body has, and you will begin to heal rapidly. Ladies and gentlemen, listen to me. Listen. Based on what we just talked about, all your body needs, all it needs today, is a more supportive environment to live in and more resources to deal with. As soon as your body has those two things, you will experience healing now. I don't care what your current state of health is. That is important when it comes to an awakening, because it fundamentally changes everything. Okay. That was the awakening. There's lesson 1.